Welcome back to my channel. I just wanted to talk a little bit about syndromes today. So this is not like a medical type of syndrome that you would need a diagnosis for. What we're going to be talking about is like carpal tunnel syndrome, piriformis syndrome, those kinds of syndromes. So what we want to get to the root of is, what is a syndrome? What does that mean? Well, in general, that is a very complex term. So it embodies a variety of things, but what it generally means is that there is likely a repetitive strain or overuse type of injury. Generally, it's chronic, likely develops because of a dysfunction or an imbalance somewhere in the body, and often is associated with compression. So what all of that means is there might not be one specific thing, and syndrome just encompasses that whole injury nature of what is going on. So when we say that we have carpal tunnel syndrome, so generally that's the median nerve. A lot of people who work on the computer or areas where you're having to be in that slightly flexed position, if you can imagine, because our median nerve is right in through here, if you're in that flex position, you're constantly shortening that area. So that area is going to become a little bit tighter. Other areas are going to also probably get tight as well, but you're adding compression onto the nerve. So very often people think that, oh, I have this syndrome, there's not really a lot I can do about it. Surgery might be my next option. Well, for some of these types of syndromes, if we look at the imbalances in the other areas, likely that surgery might not be needed. Actually, my mom, she is somebody that has dealt with carpal tunnel off and on throughout the years, but when she started seeing her athletic therapist and myself, so she was seeing an athletic therapist while I was still in school learning all of this stuff. She started seeing one just to understand a little bit more about what the heck I was getting myself into. And they were actually able to relieve a lot of that pain and actually pretty much eliminate that carpal tunnel syndrome based on using specific areas and working on specific areas to relieve that compression and help with the mobility of the musculature, the joints, and the nerves. So really, that syndrome term is very complex. And likely when I said it's due to like a dysfunction or imbalance, that means that something either up above or lower down is not firing the way that it should. So you're not getting that proper mobility. So you might be getting a narrowing of a joint space, or if you look maybe between both your arms, if you're looking at something upper body, maybe one looks slightly bigger than the other, whereas we want to have that balance. There might be a little bit of a difference depending on which hand is your dominant one and which one you generally do the most work with, but for the most part, things should be fairly symmetrical. The reason I say that these syndromes are generally chronic is because it does take a long time for them to develop over time, but that's not always the case. Sometimes things are a little bit more acute. So if you have a type of maybe crush injury or direct fall that's very blunt force trauma, you could develop a type of syndrome in there. It might not just be like a very deep bruise or something like that. So we want to take that into consideration. So that's why it's generally chronic injuries that develop into a syndrome. And things with that is you might have noticed that it starts in one area and then just somewhat progressively travels down somewhere else. And that area might then become a little bit more achy or sore. Or what you might have, so if you've ever heard of snapping hip syndrome, that might be where you're getting a snapping in the front of the hip. So that could either be overly tight hip flexors, or it could also be glutes that are snapping over that femoral head. So you're gonna get like a clunking or a snapping type of sensation with that. But what you can do with that is essentially relieve the tension, relieve the stress from that joint based on specific releases, stretches for that muscle, and retrain things, and that clunking, clicking should go away once the areas are properly balanced in the way that they should be, so that we have that normal functioning and that normal biomechanics. Because biomechanics is essentially how the body moves mechanically in a biological way. So essentially it's our human movement. And that's pretty much what a syndrome is. It's not just one thing, it's a combination of multiple things. So it's our job as the therapist to essentially ask you a lot of history questions and do a thorough assessment in order to figure out what the root cause is, and then work through that to make sure that we essentially eliminate it, or at least reduce it, to get the proper biomechanics that we require for daily living. So I hope that answers any questions about what is a syndrome, why, do I have this, why are we working on multiple areas and not just the area of pain. It's because it's a combination of multiple things that are going on in the body at once that are creating this one thing. So definitely hope that that also answers any questions that you had, or wondering, what the heck does a syndrome mean? It sounds like a very scary term at first, but it really isn't. So I want to thank you guys for tuning in and supporting me as always. Have a great day. Bye.